Hi, my name is Nancy, and my audience today is my mom, my dad, and my brother. So today I'm going to talk to you about an orthopedic surgeon. Well, first, you may be asking, what is an orthopedic surgeon? Well, this is a doctor who examines, diagnoses, and treats diseases and injuries of the musculoskeletal system with surgery or corrective mechanical devices. The musculoskeletal system is the first thing you see here. That's just a little overview of what it is and what it looks like. And this has to do anything that makes you move, like your bones, your muscles, your nerves, tendons, and joints. So then if you flip to the next page, is the education needed. Well, first importantly, you need to graduate from high school. After that, you have 4 years of undergraduate, and before you get into medical school, you have to take the MCAT, which stands for Medical College Admission Test. When you pass this, now you can apply to medical school, and that usually takes you around 4 years to finish. When you're about to finish medical school, on your 4th year, you have to take the National Board exam, or how medical students like to call it, is boards. When you pass this, you can apply to a residency program at a teaching hospital. Then comes match day. This is when all the medical students get their match or their acceptance letter to the program they apply to. The first year, when you go into that program, is called an internship. You don't get a lot of hands-on activities during this because you're still getting tested in oral quizzes on patients, so you can move fast. Then comes your residency. That usually 4 years, and during this you get more hands-on surgeries, and by the 4th year you're allowed to do a surgery by yourself without an attending, which is above you looking over your shoulder. And finally is your fellowship. That is 1 year. And according to an article by Washington University School of Medicine in St. Louis, there are 7 types of fellowships for an orthopedic surgeon. The first one is a foot and ankle orthopedics, hand and surgery and upper extremity, joint preservation, orthopedic sport medicine, orthopedic surgery of the spine, orthopedic trauma, and pediatric orthopedics. So now I've told you the education needed to be a orthopedic surgery. Now let's go to day by day. What do you experience when you're actually in the job? So I got this according to castleconnerly.com, and first you have to know you have irregular and unpredictable hours. This means that you can have a 3 a.m. call from the hospital telling that you have to go to the hospital because there's a patient that cannot wait for surgery and it may die if you don't get there in time. And irregular is that you may have a 16-hour shift one day, then you go to an 8-hour, or then a 10-hour. So this is not like a regular job that you go from 8 to 6, from 9 to 6, or 5, or like typical day like that. Then they go to consults. This is when the doctor goes to a patient's room and asks about their symptoms, see their injuries, or order any scans or tests that they need to determine if they need surgery or not. Then they check on their post-op patients, which means these patients have had surgery before and they just have to stay there for a few days just to check up and see that the surgery went well and their system is still working. And finally they have surgery. If they have any, they will do those, but if they don't, they usually catch up on paperwork or just check more on their patients. So now the salary. According to salary.com, the range is between $375,220 to $617,480. An orthopedic surgeon is one of the highest paying jobs in the surgical field. It's a really good job, but as you can see, you need a lot of education. So why did I choose this topic? I chose this topic because a few years back I had a surgery on my knee, and they made me go to the sports medicine field, and a doctor from there was very good, and he explained everything step by step of what they're gonna do, and I really liked how it involved my sport and medicine. That's one of my greatest things I like science, and then my activity put together. That's one of the amazing things I've ever heard of, and I would like to help other athletes prevent their surgery and also help them get back on their feet after they get injured. So thank you for letting me inform you on what an orthopedic surgeon is, and if you have any questions, you may ask right now. Yes.
What's a good score to get for the MCAT?
Oh, so the MCAT is divided into four sections. That is scored between 118 to 132, and to get top 25%, you have to score 508 through 513, and the top 10% is 514 to 528. And you usually try to get to top 10 because you have more advantages of getting to the residency program you want to get in. If there's any questions? No?
No.
Okay, thank you.